Hi, everyone. I'm Frank Mallicoat. I'm an anchor and reporter here in the San Francisco Bay Area for Fox 2 KTVU. My guest is the executive director of the nonprofit Hope Solutions. It's located here in the San Francisco Bay Area on the East Bay in Pleasant Hill. Her name is Deanne Perrin, and this is I'm going to start that over.
Go for it.
Out of the gate. All right, here we go. Hi, everyone. I'm Frank Mallicoat. I'm an anchor reporter for KTVU Fox 2 here in the San Francisco Bay Area. My guest is Deanne Perrin. She is the executive director of the nonprofit Hope Solutions located in the East Bay of the San Francisco Bay Area. They are on a mission to stop the cycle of poverty and homelessness, and they have been affected, like all of us, by COVID-19. Deanne joins us, and good morning, good afternoon. How are you?
Good to see you, Frank. I'm doing well. It's nice
Great.
to see you're healthy.
I'm doing just fine. I think we all are. It's been quite a couple of months. Before we dive into the COVID-19 side of this, tell our viewers exactly what Hope Solutions does for families and for those in need.
So Hope Solutions is a long-standing nonprofit in the community that provides permanent housing coupled with really intensive support services to help the most vulnerable in our community move out of homelessness and into housing and ultimately into success.
That's a nutshell, but you actually have apartment communities.
Yes.
Where there's strength in numbers, where these people have their own apartments, but if they need social services, if they need legal help, if they're looking for a job, after school programs for the kids, daycare, go into that a little bit as well.
Absolutely. I mean, for all of us, housing is just the beginning, right? It's the container from which we launch our lives. And that is absolutely what happens here at Hope Solutions. We help vulnerable people move into safe, permanent housing, and then we layer whatever supportive services they need to be successful. Parenting support groups, youth enrichment classes for the kids, homework club, tutoring, mental health support, sobriety support, whatever folks need to address the underlying issue that made them homeless in the first place so that we can end the cycle and help them and their families move into successful, productive members of society.
Well, I know you have some communities, other apartments in Contra Costa County in the East Bay. Tell us how COVID-19 has affected those communities and how you folks do your work.
Well, it's affected our communities the way it's affected every community, but the folks we serve are those vulnerable and high-risk populations. So we're serving a lot of seniors, we're serving a lot of medically fragile families, so they have needed to shelter in place double time, right? And they're sheltering in place often in pretty small places, 500 square foot apartments for a family of 3. So we have helped people make it as successful as possible. We make the housing successful. We have had to provide food support, technology support so that these families can do the online learning that we're all being called to do, mental health support, sanity support, whatever it takes to help people stay in shelter and stay sane while they are sheltering. And then we also take a lot of folks who are currently not housed and find housing. That's been a big effort for us the last couple of months. We've moved 50 homeless families off the street and into permanent safe shelter because you can't shelter in place if you don't have a place to shelter, right?
True.
So that's where we're going.
And how do you do that? How do you protect the workers and those families as you're sheltering in place, trying to get these people a place to shelter in place? That's got to be difficult too, right?
It is. We have taken a lot of care to protect our staff and the folks that we're serving. Just like everybody else, we've moved everything we can virtually. We got everybody on HIPAA compliant technology so we could do lots of virtual check-ins, but there's time when a virtual check-in and virtual support isn't enough. So we are making sure our staff have protective equipment, are following all the social distancing guidelines, checking on the health status of the clients before that they need to drop by, and just practicing all these critical practices. And I'm proud to say no one on our staff has gotten sick and none of the residents in our housing have gotten sick, right? So it's working. It's a great intervention.
So it is working. We were talking off camera before we started to record. In some ways, it's become easier too by communicating through Zoom. if you have the right technology,
Mhm.
not as much travel.
That's right.
Um, Talk about that. And do you see yourself using a lot of this in the future to cut down on that kind of thing?
I do. I think we are creating a new normal. Our staff is very nimble, virtual, mobile, doing a lot of home visits, really rolling up their sleeves and working side by side with clients. We do that as we need to, but we are moving to more virtual work. Without as much travel, we are able to check in on people more. And we're finding that in this time, people who might have been reticent to work with our team is reaching out. They're grateful for the support. They're grateful that people are looking out for them. So I do see us integrating some of these practices as we create a new normal moving forward.
I know at KTVU, our station, all but 3 or 4 of us are home.
It's a
And I'm not sure we're ever coming back. You know,
right.
they've developed technology where you can work right out of your house. So it is
Yeah.
definitely a brave new world. Give our viewers, people think of the Bay Area, it's very affluent, housing is crazy expensive.
Right.
You got the techs and all that stuff. But the homeless issue is a big, big deal here. You can talk about Contra Costa County. You know the numbers. I looked at them, and I grew up in Contra Costa
I
County,
know.
and it astounds me that in such a, an affluent area that there are big issues out there.
There are big issues, and it's sort of been hidden for a while, right? Contra Costa County is adjacent to Alameda and San Francisco County. We're a 20-minute BART ride right into San Francisco. It's a beautiful, semi-rural, semi-urban county. People didn't think homelessness existed here, but it does. We have nearly 7,000 homeless folks in our county as of last year's count. And a lot of folks are families, seniors, individuals. The faces of the folks who are homeless in our community are really varied, and the stories are really varied and unique. Housing costs are skyrocketing. People are getting pushed further and further out, facing longer commutes, and their incomes are just not keeping pace with average rents. Average rents for a 2-bedroom apartment run $2,400 a month, which means you need to make $90,000 a year for that to be affordable. Most folks aren't earning that level of income to sort of sustain housing and meet their basic needs.
Right, right. Can you give us an example? No names, of course, but
Sure.
maybe a resident there and how they've grown through the program and that kind of thing.
Absolutely. I mean, we have so many wonderful successes, but one of our longtime residents at our permanent supportive housing program is a young woman who her whole life she experienced homelessness. She was born into homelessness. She is a person who has some medical challenges, had to have many surgeries as a child, tells stories about being homeless in a body cast, right? And her parents went from place to place, struggled with substance use. She eventually went out on her own at 14 and said, I can do better on my own. She struggled. When she had her first child, she was able to clean herself up, move in, and get the support she needed from our program. She has over time gotten her high school diploma, went and got her AA, completed a BA, and just completed a master's in social work at UC
Wow.
Berkeley. She has a beautiful family. She's giving back to the community. She is someone who has unabashedly said this program has saved her life, and she does not know where she would be without that sort of ongoing support and commitment and the relationships that she's built with the staff who've been there with her through thick and thin.
It's a great story. I imagine there are still some folks in the program or trying to get
Mhm.
into the program. They've already got some issues, shelter and a home being probably number one. You throw this COVID-19 blanket on top of that. Um,
Mhm.
what is their biggest worry? What are you hearing from maybe some of the residents or people in the periphery?
The biggest worry is, will they be safe? Uh, will they have jobs to go back to? How the heck do we do this homeschooling thing in a 500 square foot apartment and, keep the kids sane and from losing their minds? So they share a lot of the same concerns that we all share. What does the future look like? Will I be safe? Will I lose my housing? Will my family be okay?
Yeah. Are the residents, do you give them access to face masks, hand sanitizers? The people,
Absolutely. That was one of my big worries as the CEO of an organization early on. We didn't want to put out a broad appeal for masks. We didn't want to compete with the frontline healthcare workers. Yet at the same time, I had staff who were at risk. And as I was really losing sleep over this one night, the next morning I walked in and a longtime volunteer said, "Hey, my friend was able to bring in 20,000 masks. Do you guys need any?" And boom, they delivered
hello.
2,000 masks, right? And we've had volunteers from all over the place dropping off masks. So now our staff are able to be safe. We're getting masks out into the community, into the hands of our residents, because they are going to have to start coming out of their shelter and they need to be safe just like everybody else.
Can you talk in general about nonprofits and
Mm-hmm.
how this has affected nonprofits financially? We were talking about your gala back in February. Thank goodness you had it early, because a lot of these nonprofits depend upon those type of events and auctions to kind of fuel the fire for what they do.
Right.
You guys are probably in pretty good shape, but I imagine there's a lot of nonprofits out there that are hurting.
There are a lot of nonprofits out there that are hurting. I think in these times, unfortunately, we will see some nonprofits that won't make it. I was talking with a colleague who's the head of a foundation who said he anticipates up to 40% of the nonprofits that exist today won't exist this time next year. So it's real. There's an opportunity for, as always, doing things a little more efficiently, but it is tricky. We're in a good place. We are providing essential services, core services. We did have our gala fundraiser right before this pandemic hit, which will sustain us. We were also very fortunate in that we got a federal PPP loan. Mm-hmm. So that will ensure our sustainability through next year and beyond while we recalibrate. Everyone will be recalibrating. But, most nonprofits are not sitting on reserves. We are raising the money and we are spending the money directly on client services. It's a pass-through. But so far, we have, knock on wood, we're in a good position and will continue to be prudent and mindful, and good stewards of the resources. But, I think we're going to see some shifts. We are definitely going to see some shifts in the community.
I would imagine too, corporate help comes, and now that they're, bailing water like all of us, mm-hmm. That's got to hurt nonprofits as well, right?
It is. And we rely on all of our community partners, our corporate partners, our foundation partners, our, generous individual donors. I think everyone's going to be pausing. We've heard from 3 foundation partners already that they're putting a pause on grant making as they evaluate their portfolios and determine how much they're really going to have to give in the community and where the primary needs are in the community. And I believe we will see more of that over the next year. There will be a pause as the dust settles and people understand what their own financial pictures are and then how they can continue to give.
Well, as I keep saying, it's a brave new world. No one really knows what lies ahead and how we're all going to react to this. And once this hopefully settles down, what will be the new norm?
Right.
Anything else you'd like to add, Deanne, at all?
I would just like to say, in the thick of it, we are continuing to house people and we are always looking for good, well-meaning landlords who are willing to take a risk and rent to our folks. We guarantee rent. We provide tremendous services. In some ways, we're a better bet than someone from tech who might be losing their jobs. And, we are creating the permanent solutions. And this is an opportunity. I think one of the silver linings here is I think we all understand more than ever that housing is a health intervention. People are safer at home. We've got to redouble our efforts to get people off the streets, to create permanent, safe, affordable living situations. And we are still doing that work every day, and we are looking for partners to help us with that.
You can't build a house without a foundation, and boy, you need a foundation. You got to live somewhere to receive all this. If they want to get in touch with you, Deanne, how do they get in touch? If to help or ask questions, what do they do?
The best thing is to go to our website, www.hopesolutions.org.
All right. Plain and simple.
Plain and simple.
Deanne, I want to thank you very much for joining us. We wish you nothing but the best as we kind of all go through this together.
Thanks, Frank. We appreciate you. Take care.
All right. Good to have you, Deanne Parent. She's the executive director of the nonprofit Hope Solutions in the East Bay here in the San Francisco Bay Area. Deanne, thanks. I'm Frank Mallicoat with Fox here in the San Francisco area. We'll throw it back to you.